Opioids are well known for their uses, as powerful painkillers and as drugs of abuse. But how do they work? There are three different kinds of opioid receptors: mu, kappa, and delta, all coupled to G proteins. These opioid receptors are activated by peptides in the endorphin family, all of which have a specific chemical structure. The chemical structure of the endorphin makes it fit into the receptor like a key into a lock. The function of the receptor depends on where it is located. Opioid receptors are located all over the body. The most important effects happen in four different areas: nociceptive or pain pathways, the ventral tegmental area, the locus coeruleus, and the digestive tract. The primary reason opioids like morphine and codeine are prescribed is because of how they stop the transmission of pain from the periphery through the spinal cord and brainstem. In the spinal cord, opioid receptors are present on both the presynaptic and postsynaptic clefts of the neurons. On the presynaptic cleft, they stop the influx of calcium, making it harder for the neuron to release neurotransmitters to transmit the pain signal. On the postsynaptic cleft, they make the receiving neuron less responsive to all neurotransmitters. In the brainstem, opioids enhance inhibitory fibers and inhibit excitatory fibers, making the signal even weaker. In the ventral tegmental area, opioids increase the concentration of dopamine, activating the brain's reward system. Usually, certain neurons monitor the concentration of dopamine and release GABA when the concentration gets too high. GABA's inhibitory nature makes it act like a brake on dopamine levels. When opioids bind to receptors on the GABA-releasing neurons, those brakes stop working, and dopamine, with all its feel-good effects, floods the brain. Endorphins produced by the body do this naturally, and they stop being produced once they've done their job. But opioid drugs like morphine or codeine flood the body with endorphins on a regular basis, and the body responds by changing its neurological structure. Recovering opioid addicts suffer from dysphoria, or a lack of dopamine, when getting off opioids, because the body has adapted to producing less dopamine. One of the important side effects of opioid addiction is the overproduction of noradrenaline in the brain's locus coeruleus. Noradrenaline is responsible for wakefulness, breathing, blood pressure, and general alertness. At first, opioids reduce the amount of noradrenaline in the brain, leading to drowsiness, slow breathing, and low blood pressure. But once someone gets addicted to opioids, their body adapts and increases the amount of noradrenaline production. Then, when opioids are present, they bring noradrenaline levels down to normal. When an addict tries to get off opioids, their body produces too much noradrenaline, and their hypothalamus and hippocampus go crazy, leading to stress, anxiety, and jitters. Another troublesome side effect of opioids arises because opioid receptors are highly present in the digestive tract. At first, opioids cause the digestive tract to slow, leading to constipation. Then, once someone is addicted and their body is adapted, withdrawal symptoms may include diarrhea. Different opioids do slightly different things based on which receptors they bind to and how well they bind to those receptors. For example, heroin binds primarily to mu receptors, which are mostly in the VTA. Fentanyl is very similar to heroin, but 100 times stronger because it binds much more tightly to the receptors and can cross the blood-brain barrier much more quickly. Here's a lethal dose of heroin next to a lethal dose of fentanyl. Pharmacological work is being done to make drugs more specifically target certain areas so that side effects are less extreme and specific issues can be better addressed.